Welcome once again, ladies and gentlemen, boys and girls, to the amazing realm of bizarre medicine. I'm your host, Dr. Franklin Ruehl. Now, roll tape!
Okay, now it's time for the world of bizarre medicine. As you may know, I'm a Ph.D., not an M.D., but I've always been intrigued by bizarre medicine. Let's see what's in the little black bag today. We have one fly swatter here. We have my surgical gloves, one monk's cowl, and a feather. And as I put the gloves on, they said this pertains to 3 recent cases in hospitals where there were, let's say, foul-ups. First of all, we have the case, let's have the wrong glove here. This was in Middlesburg Heights, Ohio. The staffers noted the man was actually asleep on the sofa in the lounge. But when they went over to him, they found that he was actually partaking of the big sleep and needed a dirt blanket. He was dead. So what I want to recommend, if you ever have to go to a hospital, for instance, as a patient or visiting someone, and you see someone on the sofa in the lounge of the hospital, go over gently with a feather and tickle him on the nose. It may turn out that he too is partaking of the big sleep and also needs a dirt blanket. Now, this monk's cowl pertains to a case in Zavgad, southern Hungary, where a man was wheeled into surgery. His head opened up and the neurosurgeon proceeded to carry out brain surgery, but it turned out it was the wrong patient. This man did not need that operation. He's currently on life support, barely clinging to life. He will be glad to know, however, that the proper patient who needed that surgery is now at home recovering very nicely. So my recommendation is to use the monk's cowl as follows. They should put a monk's cowl over anyone who is slated for brain surgery. Very simple, so no mistakes are made. You see someone with a monk's cowl on like this, realize that he or she needs brain surgery, present company accepted, of course. And now for our third case. This comes from the VA hospital in Salem, Virginia, where a nurse discovered maggots growing out of a patient's nose. Yeah, I said maggots. Apparently a female fly laid eggs in his nostrils. Terrible. The solution, give every staffer and patient a fly swatter. They're not expensive. And if you unfortunately have to go to a hospital, along with your toothbrush, take a fly swatter. You swat those flies dead. You swat them dead. And of course, that is why we call this bizarre medicine.
Now until next time, may the power of the cosmos and of the fly swatter be with you. Yes, yes, yes.